The gold standard for establishing the PAD diagnosis is the Ankle Brachial Index, or ABI, a non-invasive test that compares the systolic blood pressure in the ankle to the systolic blood pressure in the arm. The ABI test is both highly sensitive and specific for PAD. Because establishing the diagnosis of PAD is so important, all clinicians should know how to perform the ABI test and be able to offer it directly, or to refer patients at risk to an accredited vascular laboratory. The following segment demonstrates how the ABI is performed.
The ABI examination is a relatively quick exam comparing the systolic pressures in the arm and the ankle. It can be done in the office using a simple handheld ultrasound Doppler and standard blood pressure cuffs. To prepare the patient for the test, have them remove their shoes and socks and lie quietly on the examination table for a few minutes in a warm examination room. Before starting the measurements, arrange your equipment in a convenient position and make yourself comfortable to avoid awkward positioning. To take the arm pressure, wrap the cuff snugly around the arm. Place the probe over the brachial artery. Using only light pressure, slowly move it around until blood flow sounds are clearly heard. Steady your hand on the patient or the table and keep your eye on the probe hand during inflation and deflation of the cuff to minimize movement and to make sure the probe doesn't slip off the vessel. Inflate the cuff approximately 20 millimeters above the point where the sounds disappear, and then slowly, about 2 millimeters per second, deflate the cuff until the sounds reappear. Record this pressure and deflate the cuff to 0. Now repeat the process for the other arm. The ankle pressures are obtained by wrapping the cuff snugly around the ankle and placing the Doppler probe over the posterior tibial artery on the inside of the ankle. Using the same protocol as you did on the arm, inflate the cuff until the Doppler sounds disappear, then slowly deflate until the sounds are heard again. Record that pressure and deflate to 0. Repeat for the other leg. On some patients, it may be easier or necessary to use the dorsalis pedis artery on top of the foot. The ABI is now calculated for each leg. Using a calculator, divide the ankle pressure by the higher of the two arm pressures. Instead of a calculator, you can also use an ABI chart to determine the ABI.
A normal ABI value is from 0.9 to 1.3. Values above 1.3 suggest that the vessels in the ankle are non-compressible. This can be observed in patients with diabetes or end-stage renal disease. Patients with these ABI values should be referred to a vascular laboratory for further assessment by more sophisticated testing. The threshold ABI value to establish the diagnosis of PAD is an ABI less than 0.9. Patients with these ABI values are at high risk for cardiovascular ischemic events, and therapies to reduce cardiovascular risk should be immediately initiated. An effective treatment program for all individuals with PAD includes immediate smoking cessation, lowering of hypertension to less than 140/90, or if diabetes or renal disease is present, less than 130/80. Treatment of dyslipidemia with an LDL cholesterol target less than 100 for all individuals with PAD, or in very high-risk patients to a target less than 70. Management of diabetes with a target hemoglobin A1C less than 7. Use of antiplatelet medications to reduce cardiovascular risk. For patients with claudication, treatment may also include a supervised exercise program and medications to decrease symptoms. Endovascular or surgical techniques may be needed in selected individuals to improve symptoms. The guidelines suggest that all individuals with suspected PAD should have an ABI measurement. Thus, beyond use in individuals at risk, the ABI can provide a snapshot of leg blood flow health throughout the lifetime of the affected individuals. The ABI should also be measured in these classes of patients with known PAD. New patients with PAD, those who have undergone prior leg revascularization procedures, individuals with leg symptoms or signs of critical limb ischemia. For a complete review of the diagnosis and treatment of PAD, you can access the new PAD guidelines on the Internet at padcoalition.org. Early diagnosis through proper screening and prompt treatment of PAD is critical and can help save lives and limbs. This program is brought to you by the Peripheral Arterial Disease Coalition, an alliance of leading health organizations, vascular health professional societies, and government agencies united to raise public and health professional awareness about lower extremity PAD. For additional information and educational resources on PAD, visit our website at padcoalition.org.